Welcome to our first How to Become a Doctor event. We set up this virtual event just to be every other week for us as pre-health advisors to connect with you as students. We are going to record it every week in case you have to miss it. But we do want it just to be short, sweet, but helpful. So, my name is Matt Duras. I'm an academic counselor in College of Science and one of the pre-health advisors. And then we also have Mr. Robbie Bowen here, who's the director of pre-health programs. When we say pre-health, we specifically advise for medical, dental, optometry, and podiatry school. We will be referencing all of those schools today. If you are interested in PA, nursing, other programs, this may be helpful. It's not geared towards you. There is advising for those allied health professions in UCAC. So the format for today will be 15 minutes of a small teaching about a resource. Today is the competitive applicant, and then we'll have 15 minutes of question and answer, which you can put in the chat. So if you have any questions about anything related to medical, dental, podiatry, optometry, put that in the chat. We will answer them, and then we'll stop the recording after 30 minutes, and you can stick around for more questions. So I'm going to now pass it off to Mr. Robbie Bowen.
Okay, so thank you everybody for coming today. We hopefully this is going to be something that will be useful to you and to other students, and so hopefully we can get the word out that we're doing this, and we're open to presenting topics of interest to you guys. So if you have any ideas or suggestions about what you'd like for us to cover in some of these sessions, please let us know, and we'll try to make it something that's worthwhile to everyone. So today our focus really is going to be on what does it mean to be a well-rounded applicant? Like what does that that's a term you hear a lot, but what does that really mean? And so what we have here that you see on the screen is sort of all of the characteristics that an admissions team at a medical dental school is going to look for. These are sort of, I guess, if you had to kind of write a description of what things they look for in an applicant, these would kind of be the summaries of that. And basically when an admissions officer or a dean of admissions or a member of the admissions committee, when they're interviewing or they're reviewing packets from applicants, they're interested in three questions. There are three questions that they ask that they want to see answered in your application or the information that you present. So the first thing they ask is, can you do it? Can you really succeed in medical school? The second question is, will you do it? So many people have the ability and they're smart and they're intelligent, but they lack the motivation, they lack the discipline. So, just being able to have the ability to do it doesn't mean that you're going to apply it. So can you do it? Will you do it? And then the third question is, should you do it? Is this a match for your skills, for your interests, for your individual attributes? And so not everybody who's intelligent and smart and resourceful is really meant to be a doctor. Maybe you're more suited for another career path. So can you do it? Will you do it? And should you do it? So the way that they assess these different questions is by those yellow circles that you see there on this this flyer. So the first question, can you do it? Obviously, that's going to be academic ability. They're going to use things like your grade point average, the scores on the admissions test, the DAT, the MCAT, whatever your test is. These are sort of screening devices that help them determine, do you have the intellectual ability? Do you have the problem solving ability? Do you have the reasoning skills that you're going to need to be successful in medical school or dental school? There are very limited seats, and they are not able, because the medical and dental schools work in sequence, they can't replace you. If you don't work out the first year, they're not able to bring somebody in to replace you in that second year. So they don't want to waste a seat on people who aren't going to be able to make it. So the initial screening is, can you do it? And that's basically where the academic ability and the test scores come in. The second thing that they move into is, okay, this person has the ability. They have obviously demonstrated that they're smart. They do well in classes. They're good test takers. But, will they do this? And so the questions for will they do that, the things that support that are, show that, yes, I will do this, are the things like being self-directed. In medical school, you don't have somebody there that's going to hold your hand. They don't take attendance. They don't do all the things that you do, although some schools are moving towards that. But essentially, they're not waking you up in the morning. They're not following up to make sure that you're doing what you need to do. So you have to be self-directed. You have to have the self-discipline to study when you need to study, to be prepared for the test that they're going to give you. They're not going to spoon feed you, and they're going to assume that the basics when you come in. There's not going to be 3 weeks of reviewing organic chemistry. They're going to assume that you know that. And so you have to be self-directed to be able to be prepared and to do what you need to do. Things like research experience, that comes into play because that shows that you're actively engaged in learning, that you're not just sitting there like a sponge wanting somebody to fill your brain with something, that you are taking initiative, that you're being actively engaged in your own education. So it's not just the hands-on experience in the research, although that's great and valuable to know how to conduct a valid research project or how to use the scientific method, but it just also shows curiosity, that you are actively engaged in your own learning process. And leadership, somebody who's a reliable, dependable leader, somebody who takes care of their responsibilities, is successful as a team player and a leader, is going to be somebody who is willing to probably, put in the work to be responsible, to be reliable in medical school. So, when you're looking at these characteristics, they're not just these random things that people have sort of thrown out there. There's a purpose behind them. It demonstrates to them that you can do it and that you will do it through your leadership skills, through your self-direction and things like that. So, people always say, well, maybe I have a lower GPA, I can make up for it by having a really strong test score. But, each of these circles is the same size. They're each equal in distribution. Everything is important and everything matters. Law school has a sliding scale. You have this GPA, you need this on the LSAT. It doesn't really work that way in medical or dental schools. They're looking more for balance, and they're looking for excellence in all areas. And so, can I have a lower GPA and make up for it in the MCAT or the DAT? Not really. I mean, it helps obviously to have a good, to be strong in one of the areas, but they can fill their class easily with people who have both, who have the strong GPA and the MCAT. So there's not really a reason for them to make exceptions or to go down, the line and pass up people who have both. So you want to be able to present a strong case both through your grades and through the scores that you earn on the test. And so, sometimes looking, if you have a low GPA, but you do really well on the test, the question then comes in, obviously you're smart and you can take tests and you're good at it, but why do you have this low GPA? Are you lazy? Do you not, go to class? So it introduces questions that you don't necessarily want to be there. You don't want to give them any reason to question or to do that. And conversely, you can memorize really well and do well on a test, but I mean to get a good grade in a class. But when I'm testing you on the MCAT or the DAT, a lot of those questions are problem solving and problem based. Can you apply the information that you've learned? So having a really good GPA shows that I can prepare and memorize to regurgitate the information on the test. But when I'm put in a situation where I have to apply that knowledge, that's why the test score is important. So can you do it? Will you do it? And then the last one is the should you do it? You know, again, as I mentioned at the beginning, you know, just because you're intelligent and just because you, you know, are good in science and that you have, you understand the basics of biology, doesn't mean that medicine is where you should apply that knowledge or that information. It's really important for physicians and dentists and optometrists to have the soft skills, I guess, is a way to describe that. And that means people skills. You're going to be seeing people at their most vulnerable. They're going to come to the doctor to see you when they're sick and when they're, you know, at a low point in their life. And so that's why things like being able to effectively communicate are important. Every patient is different, and there's not a rote response that you're going to be able to give. You need to present the same information to 3 different patients, but they understand their level of understanding, their emotional situation, all these different things come into play. So you have to be able to know how to effectively get the communicated message to the people in a way that's kind and caring and compassionate. And so that's where, you know, communication comes in. The core competencies, you can see these on the AAMC website, but they're things like, you know, having an appreciation and understanding of diversity, that people come to you from different backgrounds and that I am able to understand that. It's, you know, things like being in, having integrity and being a trustworthy type of person. People are putting a lot of trust and faith in you, and you need to be able to live up to those expectations. And that's why clinical experience, things like volunteering in a medical setting, having a part-time job in a hospital or clinic, because it puts you in situations where you can demonstrate these skills. It lets you test yourself. Is this really the match for me? You know, we've had people in the past who really thought they wanted to be a doctor, and they go and they shadow in the emergency room, and the first time they're faced with, you know, something, you know, horrible, a horrible accident or something like that, they realize this is not really what I want to do. And so if you come into an interview and you have no clinical experience, or your clinical experience is very limited, it's just been shadowing, where you've kind of seen the nice, pretty side of medicine in a nice plush doctor's office, they're going to want to know, like, how do you know that you're going to be able to deal with the Dr. Eubanks from the medical school in New Orleans calls it the smell of medicine, and, you know, the blood, all those other things that you have to encounter. You don't get that from a nice shadowing in a doctor's, you know, this, you know, wealthy, famous clinic. You're going to see that by volunteering in ER. You're going to see that by working at an inner city clinic. You're going to see those types of things face to face through patient contact. And so, you know, should you do it, you know, you have to be able to demonstrate that I'm passionate about this. The strong applicants have hundreds and hundreds of hours of experience because it's what they love. They get a job in a hospital and they love it. They want to work as many shifts as they can. They try to spend their summers, you know, working full time there. So, you know, it's just showing that commitment and that passion. And sometimes, you know, it isn't, you know, you can still be in the medical field, but maybe not as a doctor. Maybe you want to do medical, maybe you're more suited for the research lab. Maybe you're more geared towards, you know, finding the solutions to diseases rather than treating them. So it doesn't mean that you can't be in the healthcare field, but the role of doctor, the role of dentist, the role of optometrist is not just being knowledgeable and smart, it's being able to compassionately deal with people. And so, you know, you want to be strong in all these areas. As I said, you don't want to bring up any questions where they're wondering about anything. You want them to see a well-rounded, complete package. It doesn't mean you have to be perfect in all these areas, but you need to demonstrate, you know, commitment to at least striving to achieve these accomplishments. And so, you know, I always say, like, people say, well, you know, if I don't have this area, you know, I have never done research, does that mean I'm not going to get in? No, it doesn't mean that. But, you know, it's like a table. A table has 6 legs. If one of the legs is missing, can it still stand with 5 legs? Well, sure it can, but it's just not going to be sturdy. It's going to be wobbly. It's going to be things like that. So you want all of the firm foundation that you have, so that there's no concern or no question about any of your abilities. So I think that's kind of the overview here. This is just a good little handout, a good little thing to have and to kind of assess yourself. If you're a freshman, maybe you don't have all of these things yet because you're just starting. But if I'm ending my junior year and I'm getting ready to apply, hopefully I've been able to develop some of these skills. So, just kind of use this as a self-assessment tool and look at these things from time to time. How am I doing in these areas? What's an area that I really need to focus on? Like, I really need to spend time learning how to be a better communicator. How can I do that? Maybe I can, get a leadership role in a student organization, and that will help my leadership skill, but also teach me how to communicate effectively. So, it's kind of going back to this from time to time. How am I doing in this? Where are areas that I can improve on? And hopefully by the time you're ready to apply, you're good in all these areas, and that's going to make you a much more competitive applicant.
Robbie, thank you for sharing all that. Now we're open up for questions. It can be about this or anything else. Robbie, the first question is going to be on the academic ability side. Is there a certain major that you should choose for medical school? And inside of that question, does it matter for your number, like what number you have your GPA, or does it also matter like what classes you take towards that GPA?
Yeah. So there's no specific major that you have to choose. I mean, we literally have had students go to med school from music, theater, engineering, you name it. We've had people who go to med school from all the different areas. So I don't think it's necessarily as important what you choose to major in. What our advice for people is, find something that you're passionate about, that you really enjoy, and study that if that's what you want to do. That's usually going to translate into you being happier and more interested in the material that you're studying, which hopefully translates into better grades. But science grades are going to always be important. Medical and dental, optometry, podiatry, they're all science. And so the performance in your biology, your chemistry, your physics classes are always going to be really, really important. If I'm a science major, I'm majoring in biology, I'm probably going to take 50 or 60 semester hours worth of science. So if I slipped up and made a C in a biology course, I've got 45, 50 other semester hours to balance that C out with. If I'm a sociology major and I'm just taking the basic required sciences, the year of biology, 2 years of chemistry, the year of physics, then those grades become even more important because I don't have the safety net of 50 other semester hours. A C in my basic science courses when I'm only taking the pre-med prerequisites, that C has bigger impact. So you can major in anything you want, and you should major in things that you enjoy, but you have to understand that science is the key to medical or dental school. And where we get nervous is if people say something like, I don't really like biology, so I'm going to major in, history or something. That's a huge red flag, because biology is going to be your life from now on. So it doesn't mean you have to major in it, but you definitely have to demonstrate that you're strong in that. And the MCAT, the DAT, all of those courses are science-based courses. And so science is always going to be important, but it doesn't mean you have to be a science major.
Okay, great. Yeah, so the next question has to do with that clinical experience. What should you look for when you're trying to get clinical experience? And is it better to get like a bunch of little experiences, or, maybe a few bigger ones?
Mm-hmm. Well, I think the key when they talk about clinical experience, the thing that they're talking about is patient contact. So having face-to-face contact with patients, where you're having to communicate with them, you're having to talk to them. Now, obviously, as a volunteer or a student, you're not going to be doing surgery. You're not going to be doing any of those, clinical aspects of things, but it's learning how to interact with patients. If you're shadowing, that is more, there's nothing wrong with that, and you can certainly learn a lot about bedside manner, and having an opportunity to observe doctors is a learning experience, but it's more of a passive thing. You're watching someone else do stuff, and for them, they would rather see hands-on experience where you're the person talking to the patient, you're the person escorting the patient back to the examination room, things of that nature, rather than just watching from the corner someone else do that. So normally clinical experience, what they're looking for is patient contact. Now there's a lot of ways you can get that. You can get that through global brigades, taking a mission, going on a global brigades trip to the Honduras, and you're assisting in a clinic, and you're checking patients in, and you're taking their name and their medical history and why they're here at the clinic, and doing that. And that might be a 1 week, and you get that experience through that. It could be a part-time job where you work in a doctor's office, or you have a job in a hospital or a clinic, and you get to understand how the hospital works and how all the units kind of coordinate together. So it doesn't have to necessarily be paid. It can be volunteer. It can be 1-day things. However, I think that it's long term. There's nothing wrong with a 1-day experience or doing 4 or 5 different things, but I think you get more value out of making a long-term connection. The people that you're working with, if I've been at the same clinic for a year and a half, they know me, they know that I'm stable, and they're going to allow me to do a lot more stuff than if I'm just there for 1 day, or I come once every 6 weeks or whatever to volunteer. You're just going to get more out of it if it's something that's a long-term experience. They're going to trust you, they're going to know you, they're going to allow you to do more things, and you're going to learn more from doing that. So I think there's value in a long-term commitment or a long-term experience, but there's that doesn't mean you shouldn't do a 1-day service event, or they have these clinics that they do around Baton Rouge a couple of times a year, where it's a couple of days of a clinic, for a free clinic, and going and volunteering there for 2 days is great. It's a wonderful experience, and you should not do that. But I think you get more, it's always about what are you learning from it. It isn't, I did 6 months or I did 3 months, which is better. It's what did you learn from it? How, what are you taking away from that? The interview is not going to be how many hours the question is not going to be how many hours did you do it, or how long were you there. The question is going to be, what did you learn from that experience? How has that experience helped you be a better applicant? What did you take away from that experience? Tell me about an interaction that you had with a patient at this volunteer location. So, it's all about what you took away from it, and you can take away a lot from a 1-day experience that can be very effective. But I just think the opportunity that you get out of a long-term experience is usually more helpful.
Okay, great. Yeah, the next question would come just with that ability to communicate effectively, the relationship with faculty. Can you speak about the importance of your relationship with faculty and how that applies to getting into professional school?
Yeah, every school, every application to a professional school is going to require letters of evaluation from faculty members who taught you in the classroom. So it's part of the process. They rely on faculty members to give them an overview of your preparation, your suitability, the type of student that you are. And so, obviously I'm going to need letters of recommendation. It's going to be a much better letter if I've developed a relationship with them. I understand that that's, not always easy when it's a class of 250 people or whatever, but it's finding ways to get a connection with faculty member. That might mean they have office hours every Tuesday from 2 to 4, and something that we talked about in class this week really interests me. So I'm going to go during office hours and ask, can you give me some more information about this? Can you tell me how I can learn more about it? Maybe I'm struggling. I don't understand what we're talking about in class. So I can go during office hours and say, I'm really having a trouble understanding this. Can you help me? Can you help me figure this out? Ask some questions that shows that you're actively trying to do well in the class, that, it shows them that you're working hard. And, those are ways that you stand out in the classroom, by doing that. So, this is where research experience comes in. If you're working in a research lab, you're going to be working under a faculty researcher. And so they get to see your work ethic. They get to see that you're dependable, that you're reliable. You show up when it's your time to be in the lab. So when they write that letter, it's going to be much more personalized. It's going to be a much more useful letter than, he took my class, he got an A, he finished in the top 10%, I wish him well. A letter from somebody who says, this person came to see me frequently during office hours. I could tell that she was really working hard to try to understand the content. She was present every day in class. She engaged in the classroom discussion. She asked questions. She participated in, after hour discussions, those kinds of things. So faculty relationships are really important. And I know that that's something intimidating as a student. But I think that, especially in the science courses, they know that this is just they know the process, they know how medical and dental schools work. And it's almost like they consider that it's part of the job that I'm going to be writing letters for people. But, they're going to be very honest, and they're going to give honest opinions about their impressions of you. So it's important that you establish those relationships where you can. It doesn't mean you have to know them, personally. You have to know all about their life. They have to know all about your life. You don't have to babysit their kids or anything like that. It's just, I saw this person in class every day. They came frequently to get questions. After tests, they ask questions about why they missed this, this content. Things like that is what that is talking about.
Okay, great. And then the last question just has to do with kind of timing for MCAT, DAT, OAT. When would you think about taking it? And if that, then when would you think about studying and preparing?
Yeah, so typically the tests are usually taken in the spring of your junior year. The MCAT is given from January through September. They're this next year, like 30 test days that you can take it. But, it's generally done in the spring of your junior year. So there are lots of things to think about with that, because, you want to take it when you're prepared to take it. And so if you finished all your required courses, you're going to be tested. The MCAT has organic chemistry, it has general chem, it has physics, it has biology, it has biochem. So if I finished all those courses by the end of my sophomore year and I want to take it, after my sophomore year, that's fine. The timing is not necessarily important, but it's being prepared, and the content of information that you're going to be tested on. Typically, it takes you about 3 years to get through that. By the time you get through general chemistry and organic chemistry and you take biochem, that usually is your junior year. And so that's the time that most people do it. When should you start studying? It's never too early. I always tell people, I would start immediately preparing for the MCAT and DAT, when I'm a freshman or a sophomore. And the way that you do that is you just build into your weekly schedule some time for MCAT and DAT. And that might just start out by, I'm just going to go read about it. I'm just going to find out about the test. What's the format? How long is it? What are the questions? So you start familiarizing yourself with just the basics about that you might do that in your freshman or sophomore year. And then, the best preparation for the test is going to be learning the material in biology, learning the material in organic chemistry, because if you're grasping that and you are learning it while you're taking the class, then you have the knowledge that you're going to be tested on. But what I recommend is, Tuesdays and Thursdays from 1 to 3 is going to be my DAT time or my MCAT time. And I'm going to treat it like a class. I'm going to treat it like a part-time job. And I'm going to devote my time to that, the MCAT or the DAT. Eventually, as I get closer, I'm going to start taking practice tests. I'm going to, get a workbook and start working through, sample problems. I'm going to enroll in a prep class through Kaplan or Princeton Review. But right now, wherever you are along the journey, you can start preparing for that and getting your mind thinking about that. Just by taking a couple of hours every week, you don't have to totally disrupt your schedule. I think the mistake that people make is, I'm going to take the test in April of my junior year. So starting in like February of my junior year, I'm going to become a hermit. I'm going to quit everything. I'm not going to see my family. I'm going to study 40, 50, 60 hours a week. That just is not going to work. Life happens, things come along. There's always something unexpected that you have to deal with. So if you start just doing a couple of hours a week in your sophomore year, by the time your spring of your junior year comes in, you've done hundreds of hours of prep time without really disrupting your weekly schedule. You can still do stuff with your friends. You can still go to the games. You can still, go out to the movies and stuff like that. Because you're just building it in as a weekly, activity, like you do class or you do your job or whatever. So I think that's the best preparation. Learn the content and the material, start early, get a game plan, and build it into your weekly schedule.
Okay, thank you. Well, look, that concludes our program for today. I'm going to stop the recording, and you're welcome to stick around afterward if you do want to ask any questions or to speak to us more.